I have the pleasure of conversing with Dr. Virginia Pressler, who is the Director of the Department of Health in the state of Hawaii. Thank you very much for taking your time.
My pleasure.
You're a very busy lady.
Well, there's lots going on at the Department of Health. There's always something.
Please share with us your vision and your mission, because every leader comes in with something new.
Mm-hmm. Okay, well, in between putting out fires and taking care of the latest crisis or outbreak of disease or sewage spill or whatever it might be, I've worked with our whole team at the Department of Health to put together a strategic action plan for the next 5 years, and hopefully to last for many years beyond that. And it's all about creating a culture of health throughout the state, so that health is everybody's kuleana. It's mine, it's yours, it's your community groups, it's your workplace, it's your family. Everybody needs to own health in order to create a culture of health throughout the state. And we're focused on moving upstream to try to really create healthy families for healthy babies. We know that having a healthy baby starts long before conception. So we're doing many things together with the Department of Human Services and also with the Department of Education, so that we can create a comprehensive approach to supporting families and addressing some of those social issues that impact health outcomes as well. So we're trying to make sure that more babies are planned, so that we know that the mothers have the support systems that they need, they're prepared to have the child, and they have a safe and healthy environment to give that child the best opportunities. We're also working on trying to integrate behavioral health into primary care, because behavioral health is so neglected, and that to me includes both mental health issues as well as substance abuse. And we're hearing more and more about the opioid problem across the nation. It's less of a problem in Hawaii, but it's still an issue, and it's a symptom to me of a larger problem with some underlying behavioral health issues. So we need to decriminalize it and treat it as a chronic disease, and make sure that we're giving people the support that they need so that they can live a healthy, our objective is wellness and true health. The other major piece that we're doing is trying to make full use of technology. So using things that we call like telehealth, which is can be just your smartphone, or it can be a kiosk where there's blood pressures and blood sugars and things like that remotely, so that we can get better access to care, not only for people on the neighbor islands, but even just our kupuna, so they don't have to be bundled up into the car to go to a doctor's visit, that they could actually be seen in their own home and have the support systems that they need there. And so those are the things that we're putting together statewide.
And creating not only the vision, the mission, but the action plan is so coherent with who you are. I appreciate how we started the conversation with putting out fires, because the Department of Health has huge responsibilities in so many areas. I love how you talk about the partnerships among the departments.
Yes, that's critical, because, for instance, a good example that we're working on is home visitations to families in need, and Department of Health sees these families, and Department of Human Services sees them. Sometimes we might see the child and they might see the parent. So what we're doing is we're working to create joint site visits and sharing of information, so that we can provide better support and be much more effective and efficient of the resources that we have to get to more people, and to make sure that we have coordinated care and we're treating the whole family. It's what Department of Human Services is calling Ohana Nui. So we're working in partnership with them to help make that happen throughout the state.
Your work has been professionally always about building partnerships.
Well, I took the job in the first place. I was Chief Strategic Officer at Hawaii Pacific Health, and I'd been there for 12.5 years. I had no intention of leaving, so when I was asked to take this role, I said no initially. But when I saw the governor's vision, and I've known the governor for many, many years in other capacities, I trusted him, and I knew that I could work with him. I realized that I could make a difference, and after thinking about it for several months, I finally realized I should do this, and I'm glad that I did. It's been January of 2015, so a little over 2 years already, and I feel very good about the things we've accomplished.
You've always made a difference. You continue to make a difference, and thank you very much for joining us today.
Thank you.
We've been chatting with Dr. Virginia Pressler, Director of the Department of Health in the state of Hawaii, and thank you for joining us.